It's Dr. Jim with another interesting CBD topic. And I have a lot of clients who come in to talk to me about a very specific type of pain, neuropathy. So, my topic is CBD and neuropathic pain. So, neuropathic pain is also called nerve pain, neuralgia, neuropathic pain, so on and so forth. It does affect over 20 million Americans, and it can range in severity. So it could be mild, it can be moderate, severe, chronic, and it might even be caused by a chronic or progressive nerve disease, which is the result of an injury or an infection, or in general, when the health problem or a health problem impacts the nerve that carries sensations to areas of our brain. Treatments, there are many types of treatments out there, and people try all sorts of things: exercise, OTCs, over-the-counter pain medications, as well as prescription drugs like gabapentin. And a lot of my clients come in on gabapentin. So, recently, some Australian researchers have been performing animal studies. So these would be preclinical, not on humans, but on animals. And they report that CBD can be beneficial to people who experience neuropathic pain. So let's dive a little bit deeper into neuropathic pain. You might know some people, it's pretty common. Neuropathic pain is a chronic form of pain that develops from lesions or damage within the nervous system, which includes the peripheral nerves, spinal cord, and the brain. So it can be caused by conditions like shingles, diabetes, HIV/AIDS, stroke, Parkinson's disease, multiple sclerosis, and even alcohol use disorder. And it's going to require some form of treatment, like physical therapy, prescription medication, psychotherapy, and if it's severe enough in certain cases, surgery. So, damaged nerve fibers send inaccurate signals to pain centers around our body, which result ultimately in neuropathic pain. So, what are some symptoms? It's interesting because depending upon the person, the length of time they've been dealing with neuropathic pain or neuropathy, whether they have diabetes or not, so on and so forth. A lot of factors, lots of variables will determine symptoms. Depending upon the type of nerve as well that's affected, symptoms will vary. And you may hear symptoms like numbness or pain that is either sharp, jabbing, throbbing, burning, prickling, or tingling. Pins and needles, flames, cold, so on and so forth. Other symptoms can include extreme sensitivity to touch, muscle weakness, lack of coordination, and the inability to move around well or independently. Now, there are current pharmacological treatments, and here's a handful. Over-the-counter, OTC pain relievers, antidepressants are being used more and have actually over the last few years as pain meds. Interesting. Anti-seizure medications, topical treatments, of course, physical therapy, psychological therapy, nerve blocks, and surgery. And of course, we know that steroids can be used as well to treat symptoms of nerve pain, as can immunosuppressants, injections of immunoglobulin, and others. At times, it can be very difficult to treat nerve pain, and the underlying cause of pain, in many cases, might be unknown. And if you don't know it, you can't treat it. And of course, any of these medications that I just mentioned can have negative side effects. So let's talk about what you really came here for. Talk to me about CBD, Jim. So there are some research findings out there. I'm always looking at research findings on dozens and dozens and dozens of physical health, mental, emotional health, neurological, neurodegenerative kinds of conditions, on sleep, you name it. So here are some research findings. In general, we know this, okay? The effects of CBD on inflammation, pain, and other symptoms all begin where? Within the endocannabinoid system. And this is a lipid signaling system composed of endogenous cannabinoids, okay? Two of the most common endocannabinoids are anandamide and 2-AG. They're found all the way throughout the body and the brain, and they are responsible for doing several things like regulating pain, anxiety, memory, and mood. And in one particular study that I read, a oral mucosal spray, so it's a spray you spray it in the back of the throat, did find some pain relief when compared to a placebo. Although I've read other studies where CBD didn't do that much. It was slightly noticeable, but not really great, not really significant. But yet another study that I have read recently showed that topical CBD, pain balm, cream, roll-on, whatever it is, reduced focal pain associated with peripheral neuropathy. Now, there's a medication out there, and it's called Sativex, Sativex, and it's an oral spray used to treat specifically neuropathic pain, overactive bladder, spasticity, and symptoms of multiple sclerosis. And I've seen some very good results, and has been shown to reduce intensity of pain caused by peripheral neuropathy as well as MS, multiple sclerosis. Some researchers stated that this medication, Sativex, is actually a 1-to-1 ratio blend of THC and CBD, provides superior pain with few side effects. So CBD all by itself, it might work, it might not work. CBD with THC for more severe cases of pain probably will work better because of the entourage effect. Here are my final thoughts on this. Neuropathic pain, it can be mild or it can be debilitating. Affects enough people in the United States and can be very difficult to treat. And although we do have pharmaceutical options and physical therapy and so on and so forth, we know that meds come with potential side effects, some pretty dangerous or deadly. So there is this urgency to find something all natural, organic, something based out of a plant, based out of the earth, that can be used for a very long time on a daily basis. The CBD molecule lasts up to maybe 8 hours, so taking it 3 times a day might really give you the best benefits. So there is some urgency in research to look at CBD by itself or CBD THC, with the use of a medical card for all types of pain, but specifically for neuropathic pain. It can be a natural option. Some studies have found very good results and other studies not so good. So the verdict is not completely in, but what I'd like to end with is it might be worth trying, even if it takes it's not going to cure anything. I always have to say that, and I tell everybody that'll listen to me. CBD cures nothing, THC cures nothing, but one or both may manage symptoms fairly well, very well, or I have clients who say, my goodness, CBD has really changed my life. So it could be a good alternative, or it could be an add-on treatment with other medications. And as always, with any type of research, we need more research and we need more time before we can really conclusively say CBD by itself or with its other molecular buddy, THC, in combination, may really reduce and manage symptoms of neuropathic pain. I'm Dr. Jim. Thanks for listening to me and watching this video. Keep coming back for more CBD-related information and lots of other research that I'm constantly doing. Thank you for watching the video, and I'd like to show you my new book, Living Longer and Stronger with CBD. It took me about a year and a half to write as I scanned hundreds of articles in prestigious journals, peer-reviewed medical studies, examining the effects of CBD for various physical conditions, emotional and mental issues, and neurodegenerative conditions. And I condensed all of those findings into one book. I believe that there's something in here for everyone. So if you're interested, follow the link to the book on Amazon. Thank you so much.